Hi, I'm Suzanne Perkins. I'll be doing your assessment today. Can you tell me your name?
Peyton Buckley,
And your date of birth?
02/18 of 2000.
Okay. And before we came in, we did your height and your blood pressure, and you were 6'1".
Weight,
Your height and weight, yes. You were 6'1", and your weight was 190. Now I'm just going to get your blood pressure. Can you tell me what the year is?
2019,
And who's the president?
Donald Trump.
Good. Good. Your blood pressure was 126/78. And where are we?
Hebron, Kentucky.
And what brings you in today?
Checkup.
Okay. Good. Pulse is 64 and regular. Respirations are 14, even and easy. I'm just going to palpate your scalp a little bit and check around for any bumps or bruises. Any tenderness at all?
No.
Okay, normal cephalic. Now I'm going to look in your eyes a little bit. Can you look at me? Good. Pupils are reactive. And then look at me. Just checking for strabismus. Good. Good. And the red reflex is intact. And then I'm going to come close and look into your eye. If you can just stay kind of still. Try to keep your eye open. Just looking at the fundus, the optic disc, the nerves. And everything looks good. All right, can you hold one nostril closed, inhale and exhale, and then the other side? Any trouble breathing?
No.
Okay, and look in your nose. Septum is midline. I can see turbinates. Mucous membranes are moist and pink. Can you say ah? And lift your tongue. Good. And oral membranes are moist and pink. No issues with dentation. Any tenderness in your ears?
No.
Okay, I'll look inside. And the tympanic membrane is pearly gray. I can see the landmarks. Good. Now I'm going to test some cranial nerves. So if you can close your eyes for me, I'm going to have you tell me what the smell is.
Cinnamon.
Good. That's cranial nerve 1. And then cranial nerve 2, we already tested some, but can you, on the Snellen chart, read the lowest line that you can see? Yes, cover one eye, please.
LT, FPH.
Good. And then can you cover the other eye and read the opposite direction?
HP, FTL.
Good. And then can you look at my finger? And accommodation's good. So that tests cranial nerve 2. And then cranial nerve 3, 4, and 6 is the H test. Can you follow my finger? Keep your head still. Good. And cranial nerve 7, we'll check by having you raise your eyebrows and smile really big. Frown. Puff out your cheeks and show me all your teeth. Good. And then cranial nerve 8, we'll check by whispering something in your ear. Just tell me what I say.
Blue. Red.
Good. And then cranial nerve 9 and 10, I'll check your uvula to see that it rises, and then your gag reflex. Say ah. Good. And then cranial nerve 11 is shoulder shrug, if you can push up against my hands. Good. And then can you stick your tongue out and side to side? And that's cranial nerve 12. Good. All right, we're going to test your hearing. this on your head and just tell me if you hear it equally on both sides or in one ear louder than the other.
Equally.
Okay. And then put this on your mastoid process and tell me when you stop hearing it.
No.
And then tell me when you stop hearing this.
No.
Good. That's twice as long, which is what we want. Same here. Tell me when you stop hearing it.
No.
And tell me when you stop hearing this.
No.
Okay. And then I'm just going to palpate your sinuses, your maxillary, any tenderness there?
No.
And your frontal, any tenderness there?
No.
Okay. And then I'm going to inspect your neck and palpate any tenderness.
No.
Can you swallow for me? Good. And then just your lymph nodes, so your occipital, postauricular, preauricular, parotid, submandibular, submental, your anterior cervical chain, and your posterior cervical chains, and your supraclavicular, and everything feels good. All right, now, if you can close your eyes one more time, I'm going to place something in your hand. If you can tell me what this is.
Key.
Good.
Yeah.
And then this is going to be soft touch, and this is sharp touch. So if you can tell me sharp or dull every time I touch you.
Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Dull.
Good.
That was
Alright.
kind of what you did.
Was it?
Yeah.
Okay, now I'm going to check your shoulders. Just going to check your joints and range of motion. If you can push kind of against my, okay, and can you push against my hand? Push against my hand. Are you able to go side to side and look over your shoulder? And then flex and extend and down to your chin or down to your chest. Good. And then with your shoulders, can you kind of move them around? Good. Same with your elbows, wrist, hands. And then I'm going to do the same thing. Just tell me if there's any tenderness. Can you fan your fingers out and keep me from pushing them together? Good. Move your shoulder, just relax. Your elbow, your wrist, your hands. Any tenderness?
Nope.
Fan your fingers out, keep me from pushing them together. Good. And then can you squeeze 2 fingers as hard as you can? Good. And then I'll test your strength. Pull back toward you. Ooh, and push. And same here. Pull and push. Good. Okay. Now, if you can stand up for just a minute, I'm going to listen to you in the back. Step forward just a little. Okay. Few kind of deep breaths. Good. And then can you take a big deep breath in and out? Good. I'm going to percuss a little. Take a big deep breath in and hold it. Sorry. And then a big deep breath out. Hold it. Okay. Any tenderness?
Nope.
Can you lean straight over and touch your toes?
Nope.
Well, just try as far as you can. I'm just going to check the curve of your spine. Looks good. You can stand back up. Can you walk toward the wall just slowly for me? Good. And then turn around and walk back toward me, but heel to toe. Beautiful. Okay, you can have a seat. We'll listen to your lungs in the front. Take a couple big deep breaths. I'm going to raise this arm a little. This arm. Good. Okay, now if you can take a deep breath and hold it for a second, I'm going to listen to your carotid arteries. Good, and again. Good, you can breathe normal, no bruise, and now I'm just going to listen to your heart. And the aortic, pulmonic, second pulmonic, tricuspid, and mitral. And then same thing with the diaphragm. Okay, and then if you can lay down for a minute, I'm gonna check your abdomen. Okay, just gonna pull up your shirt a little bit. Good. And first I'll just inspect, look at your umbilicus, look for any pulsations or peristalsis. And I don't see anything. Contour is flat. And I'm just gonna listen for vowel sounds in 4 quadrants. They are audible, active, normoactive. Good, and then I'm just going to listen for bruits in your renal arteries, in your aorta. I'm going to go ahead and check pulses. Radial, and brachial. And they're 2+ and even. Posterior tibial, your dorsalis pedis. Go ahead and check cap refill. Fingers also. Good. And then we'll check some reflexes. You can just rest your arms just like that. Good. And then just dangle your arm. Let me hold it. Relax. Good. Good. Just relax. Dangle and relax. Okay, and I know you can't really dangle your feet, but there you go. Patellar, get your Achilles. Okay, good. All right, I am going to palpate. Do you mind to lay back down? I'm going to palpate your belly. Ooh. All right, so first just lightly palpate and just let me know if anything's tender.
No.
And then some deep palpation. Anything?
No.
Okay, and I'm just gonna feel for your liver and your spleen. And then see if I can feel kidneys, which I can't. I'm gonna percuss for liver. Okay. It's about 4.5 centimeters, which is good. Okay, you can sit back up. I'm gonna see if I missed anything. I'm gonna check your coordination. So you can close your eyes and do alternating hand movements on your, but touch your nose, touch the tip of your nose with your index finger. There you go. And roll fast. Good, now if you can open your eyes, put your hands out, flip them back and forth really fast. Good. And then if you can stand, close your eyes, put your feet together, hands down to your sides. Good, you can open your eyes.
Can I sit down?
Sure. Okay, one more thing. If you can stand and say 99 every time I touch your back. Go ahead.
99, 99, 99, 99,
And we'll do the same in the front.
99, 99, 99, 99.
Okay, that concludes our assessment.